third point is then that genital warts, at least one vaccine protects against genital warts as well, present a nasty problem in both genders, as you could hear it in the previous presentations. And finally, we have a realistic chance to eradicate these viruses because they're solely restricted to humans. But if we really wish to do this in a foreseeable period of time, we have to vaccinate both genders as soon as possible. Does the vaccination result in a prolongation of intervals for cervical cancer screening? One would not recommend it today, but maybe the situation will change in the forthcoming years with the application of different forms of cervical cancer screening. While the acceptance rate for vaccination against high-risk HPV infections in several countries relatively low, well, from a number of lectures which I gave and which I hear from my colleagues, the major factor is really the insufficient knowledge of health ministries, health officials, and unfortunately also of quite a number of physicians about the effectiveness of prevention and the consequences of the HPV infections. But also teachers and parents really need to know much more about it. So advocacy here is an urgent problem which needs to be addressed much more intensively. It's in some countries the reluctance of health insurances to cover the expenses for prevention. This is particularly true for Austria, where the rate of vaccination is about 5% only, so it's extremely low. The health insurances do not pay for the vaccine. Absence of infrastructure for effective prevention and funds to cover the costs, of course, for screening and vaccination. And this is also in some states, it's a problem that a sexually transmitted disease may result, or the vaccination against such a disease may result in increased sexual promiscuity, and in even other countries, cultural and religious customs may prevent a discussion of sexually transmitted diseases with teenage girls. The fear of side effects, greatly exaggerated in the press, is clearly one other point. And as discussed from time to time, the efficacy has only been demonstrated against precursor lesions, not against cancer itself, and we still have to wait for 10 or 15 more years before we can clearly state that there's a significant reduction in cervical cancer due to vaccination. But everyone who follows the data on the precursor lesions has no doubt that this is going to happen in the future. Now, there are clearly some consequences for gynecology and